to today's Q&A. We have Vanessa Bautista from the Wallingford Health Department. We have some questions from the community that she will be answering for us today. And Vanessa is here with us. I'll be saying the questions in English and she will be saying them in Spanish as well as the answer. Is that okay with you, Vanessa?
Yes, that works.
Perfect. Okay. And just to let everyone know, the session is being recorded and it will be posted on our social media so that whoever wasn't able to attend today's meeting will be able to see it whenever they have a chance. So the first question is, what is the booster?
A COVID-19 booster shot is an additional dose of a vaccine given after the protection provided by the original shot has begun to decrease over time. The booster is designed to help people maintain their level of immunity for longer. ¿Qué es la vacuna de refuerzo? Una vacuna de refuerzo de COVID es una dosis adicional de una vacuna que se administra después de que la protección proporcionada por las inyecciones originales ha comenzado a disminuir con el tiempo. El refuerzo está diseñado para ayudar a las personas a mantener su nivel de inmunidad durante más tiempo.
Thank you. The next question is, who can get a booster?
The COVID-19 vaccine booster shots are available for the following Pfizer vaccine recipients who completed their initial series at least 6 months ago and are as follows: 65 years and older, age 18 and over who live in a long-term care setting, age 18 and older who have underlying medical conditions, age 18 or over who work in high-risk settings, age 18 and older who live in high-risk settings. ¿Quién puede recibir la vacuna de refuerzo? Las vacunas de refuerzo de COVID-19 están disponibles para los siguientes receptores de la vacuna de Pfizer que completaron su serie inicial hace al menos 6 meses. Personas de 65 años o más, mayores de 18 años que viven en entornos de atención a largo plazo, mayores de 18 años que tienen condiciones médicas, mayores de 18 años que trabajan en entornos de alto riesgo y mayores de 18 años que viven en entornos de alto riesgo.
What is the difference between the Pfizer and Moderna booster?
When receiving a Pfizer booster, you receive a full dose of the vaccine. For a Moderna booster, it is likely that you will receive a half a dose of the vaccine. However, if you are immunocompromised, you will most likely receive a full dose of the Moderna booster. ¿Cuál es la diferencia entre el potenciador Pfizer y Moderna? Cuando recibe un refuerzo de Pfizer, recibirá una dosis completa de la vacuna. Para el refuerzo de Moderna, es probable que reciba la mitad de la dosis de la vacuna. Sin embargo, las personas que tienen condiciones médicas recibirán una dosis completa del refuerzo de Moderna.
What is the vaccination status for children 11 and younger? When will they be able to get vaccinated?
As of right now, it is under preliminary approval. It will most likely be approved by the end of the month. Children 11 and younger will most likely receive a COVID-19 vaccine on the first week in November. The vaccine will be a Pfizer pediatric COVID-19 vaccine, so different than the one that we have right now. ¿Cuál es el estado de vacunación para niños menores de 11 años? ¿Cuándo podrán vacunarse? En este momento está bajo aprobación preliminaria. Lo más probable es que se apruebe a finales de mes. Es muy probable que los niños menores de 11 años puedan recibir la vacuna COVID-19 durante la primera semana de noviembre. La vacuna será una vacuna COVID-19 pediátrica de Pfizer.
Can I get vaccinated and my flu shot at the same time?
Yes, you can. Just make sure to get it on different areas, not on the same arm. However, it is recommended to wait 14 days before getting any of the vaccines. So if you were to get the flu shot, you could always wait 14 days to get the COVID-19 vaccine, either the initial dose or the booster. But you do have the option to get it on the same day. If you choose to just get both vaccines at the same day, you can go ahead and do so. However, the only thing with this is that if you do happen to get both vaccines on the same day and you get a reaction, you won't know which vaccine caused the reaction. ¿Puedo vacunarme y vacunarme contra la gripe al mismo tiempo? Sí, se puede vacunar contra la gripe y contra el COVID el mismo día. Solo asegúrese de colocarlo en diferentes áreas, no en el mismo brazo. Se recomienda esperar 14 días antes de recibir cualquiera de estas vacunas, pero tienes la opción de vacunarte con las dos vacunas el mismo día. Si tiene una reacción a alguna vacuna, lo único que va a pasar es que usted no va a saber si se vacunó el mismo día las dos vacunas. No va a saber cuál fue la causa, qué vacuna, de la gripe o del COVID-19.
I lost my vaccine card. Where can I get a new one?
Contact the vaccination provider site where you got your first shot. Or if you need proof of vaccination, you can access the Connecticut Vaccine Portal online site. You click on your immunization record, then go to the Connecticut WIS Public Portal and complete the questions, and you should be able to see the COVID-19 vaccine listed on there. Perdí mi tarjeta de vacuna. ¿Dónde puedo conseguir un nuevo? Comuníquese en el sitio del proveedor de vacunación donde recibió su primera inyección. O si necesita un comprobante de vacunación, puede acceder al sitio en línea del portal de vacunas de Connecticut. Haga clic en obtener su registro de vacunación y luego haga clic al ir al portal público de Connecticut WIS, complete las preguntas y podrá ver la COVID-19 vacuna listada ahí. El sitio específico es connecticutwis.dth.ct.gov/public/application/public portal.
Thank you. And do you think you can share this link with us at the end of the Q&A?
Yes, of course.
Okay, thank you.
You're welcome.
I got the Johnson & Johnson vaccine. Will I be eligible for a booster?
Even though boosters for Moderna and J&J are recommended by the FDA and CDC, local health departments are still waiting for final approval from the Connecticut State Department of Public Health and FDA. We will most likely know for sure this weekend or sometime next week. It will most likely be a full dose of J&J booster 2 months after receiving the first dose. Recibí la vacuna de Johnson & Johnson. ¿Seré elegible para un refuerzo? Sí, los refuerzos de vacuna para Moderna y J&J están recomendados por el FDA y el CDC. Los departamentos de salud locales están todavía esperando la aprobación final del Departamento de Salud Pública del Estado de Connecticut. Lo más probable es que sepamos con certeza este fin de semana o en algún momento la próxima semana. Lo más probable es que será una dosis completa de refuerzo de J&J de 2 meses después de recibir la primera dosis.
I got a different vaccine in another country that is not available in the US. How long do I have to wait before I have to start over?
If they need to finish their dose after getting their first dose of vaccine that they got in another country, they can get a dose of any vaccine available here in the United States after 28 days. If it's a booster that they need, they will have to wait 6 months before getting a Pfizer or Moderna booster. Recibí una vacuna diferente en otro país que no está disponible en los Estados Unidos. ¿Cuánto tiempo tengo que empezar de nuevo? Si necesitan terminar su dosis después de recibir la primera dosis de la vacuna que cogieron en otro país, pueden recibir una dosis de cualquier otra vacuna disponible aquí en Estados Unidos después de 28 días. Si necesita un refuerzo, tendrá que esperar 6 meses antes de recibir un refuerzo de Pfizer o Moderna.
Can you get COVID-19 multiple times even if you're vaccinated?
Yes, you can. Infections happen in only a small portion of people who are fully vaccinated, even with the Delta variant. When these infections occur among vaccinated people, they tend to be mild. Puede recibir COVID-19 varias veces incluso si está vacunado. Sí se puede infectar varias veces. Las infecciones ocurren solo en una pequeña proporción de personas que están completamente vacunadas, incluso con la variante Delta. Cuando estas infecciones ocurren entre personas vacunadas, tienden a ser leves y no tan graves.
What is the current mask mandate?
The statewide mask policy that is currently in effect is as follows. Masks are not required outdoors. Indoors, however, vaccinated are not required to wear masks. Unvaccinated will have to wear masks. Masks are required to be worn by everyone in certain settings, such as healthcare facilities housing vulnerable populations, public and private transit, correctional facilities, schools, and childcare. Businesses and state and local government offices have the option to require masks to be worn by everyone in their establishments. With that being said, in Wallingford, we are following this policy, the state policy. However, other towns can choose to mandate mask requirements indoors regardless of vaccination status. That is why in other towns, when you go to Hamden or New Haven, they are requiring masks indoors, regardless of vaccination status. Here in Wallingford, it's slightly different. If you're fully vaccinated, you do not have to wear a mask indoors. But if you're not vaccinated, you do have to wear a mask indoors. You have that option here in Wallingford. ¿Cuál es el mandato de máscara actual? La política estatal de máscaras que está actualmente en vigor es la siguiente. No se requieren máscaras al aire libre, pero adentro, vacunados no se requieren usar mascarillas. Los no vacunados deben usar máscaras. Se requiere que todas las personas que usan máscaras en ciertos entornos, como instalaciones de atención médica, hospitales, transporte público y privado, instalaciones correccionales, escuelas y cuidado de niños. Las empresas y oficinas gubernamentales, estatales y locales tienen la opción de exigir que todas las personas en sus establecimientos usen máscaras. En Wallingford seguimos esta guía. Sin embargo, otras ciudades como Hamden, New Haven, requieren máscara en todos los lados, aunque usted se haya vacunado. Pueden ellos exigir requisitos de mascarillas adentro, independientemente del estado de vacunación.
What is the vaccination rate here in Wallingford? And if you can tell us what age group has the lowest rate?
Right now, as of October 14th, there are 32,996 residents have received the first dose, and that's about 74% of the total population in Wallingford. And it's 84% of the population here in Wallingford who is eligible for vaccination. Age group 12 to 17 have the lowest vaccination rates right now. ¿Cuáles son las proporciones de vacunación en Wallingford? ¿Qué grupo de edad tiene la proporción de vacunación más baja? Desde octubre 14 del 2021, 32,996 residentes de Wallingford han recibido la primera dosis de COVID-19, la vacuna de COVID-19. Esto es aproximadamente 74.44% de la población total en Wallingford. La tasa de vacunación de 12 años o más en Wallingford es 84%. El grupo de edad de 12 a 17 años tiene las tasas de vacunación más bajas.
And if you can give us some recommendations as we go into the cold season.
I would say the flu shot. Right now, there are many pharmacies, and I believe we will have flu shot as well open to the public. And just be proactive about getting your vaccine for COVID-19. And again, you can get both of them at the same day. The recommendation is for you to wait the 14 days just in case you have an adverse side effect or reaction. Mis recomendaciones son que se vacunen contra la gripe. Hay muchas farmacias y el Departamento de Salud de Wallingford también está ofreciendo una clínica con la vacuna de la gripe. Muy pronto vamos a dar una fecha y sean proactivos a vacunarse cogiendo la vacuna de COVID-19 y ya que saben que se pueden vacunar las dos el mismo día, pero tengan en cuenta que puede haber efectos secundarios, por eso se recomienda que esperen 14 días entre cada vacuna.
Okay. If anyone has any questions, you can type them into the chat box. Someone did ask from a question that you said earlier. They said, would that mean you have to take 2 Moderna booster shots?
No. So the Moderna, I think people are getting confused. So with the Moderna, you have 2 doses, right? That's the initial series of the vaccine. Now, after you got the vaccine, the 2 initial doses of the vaccine, in order to get a booster, once it is finalized, because it has not been finalized for the Moderna, only the Pfizer has for the booster. Once it has been finalized for the Moderna booster, you will get half a dose of the Moderna. So instead of getting that whole vial of dose, you get half of that for the booster. However, if you're immunocompromised, then you will get a whole dose. So you'll get the whole first dose. If it's just a booster and you're not immunocompromised, you'll get half of the first dose. I hope that makes sense.
Yes. And someone else had a question. It says, is it necessary to receive a booster shot?
According to CDC, eventually, as time goes on, your immunity levels will decrease. Therefore, you will need some type of booster to bring up that immunity level back up.
I'm not sure if you would know the answer to this question or not. But since we are receiving the booster shots right now for Pfizer and later on for Moderna, do you know if this will be a yearly thing where you probably have to get the booster every single year or every once in a while?
We're predicting that it is probably going to work like the flu shot. And again, with the J&J, so with the Moderna and the Pfizer, you have to wait 6 months to get that booster shot. For the J&J, they're predicting 2 months after to get the booster shot. So J&J has a shorter amount of period that you have to wait versus the Moderna and the Pfizer, which are 6 months.
And another question is it okay for pregnant women to receive a booster shot?
Yes. If you got the initial dose, it is safe to receive a booster shot.
Okay. And I think those are all of the questions that we had. If anyone else has any other questions, you can always send us an email here at SCOW or give us a call, and we will send them over to Vanessa. Si alguien más tiene alguna otra pregunta o duda, nos puede llamar aquí a la comunidad hispana de Wallingford Y nosotros le mandamos sus preguntas a Vanessa y ella nos las puede contestar y les regresamos la respuesta. Thank you, Vanessa, for being here today, for taking time out of your day.
I'm sorry to cut you off.
Yes.
One more thing. So I just wanted to mention to everyone the dates of upcoming clinics that we have, in case you have not gotten vaccinated yet. So there is one this month, the 27th. It's going to be at the Wallingford Senior Center from 12:30 to 4:30 p.m. And that's walk-in. They're accepting walk-ins. And November 3rd, again at the Wallingford Senior Center from 12:30 to 4:30. And November 10th at the Wallingford Public Library from 12:30 to 4:30. And then November 17th at the Oakdale Theater from 12:30 to 4:30. And all these clinics are doing walk-ins, no appointments required. En caso que se quiera vacunar contra el COVID-19, va a haber clínicas que no necesita cita, nomás puede entrar a vacunarse. La fecha es octubre 27 en el Wallingford Senior Center de 2:30 a 4:30. Noviembre 3, también en el Wallingford Senior Center de 2:30 a 4:30. Noviembre 10, en la librería pública de Wallingford de 2:30 a 4:30. Y noviembre 17 en el Oakdale Theater de 2:30 a 4:30. Y van a ofrecer todas las 3 vacunas.
Perfect. And just in case anybody missed any of those dates, we will be posting them on our Facebook page. Si es que alguien no escuchó o quieren un recordatorio sobre las clínicas que van a estar aquí en nuestra área en Wallingford, también las vamos a poner en nuestro Facebook. So thank you, Vanessa, for answering all of our questions, and thank you for taking time out of your day. We appreciate it. Is there anything else you would like to tell us before?
No problem. Thank you for having me. I'm happy to help the community here in Wallingford, as I am a Wallingford resident. And for the link for the vaccination card, or if you need any proof of vaccination status, I will be emailing the link to Adriana, and she can have that available to everyone. Okay?
Yes. Thank you so much.
You're welcome. Have a good night, everyone.
Thank you. You too. Bye.